Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. And in this edition, we're going to talk about the gatekeepers in nursing school. If you want to see what I'm talking about, please stay tuned. Welcome back. My name is Dr. Marita P. I'm a registered nurse, been a nurse for now 18 years. OBGYN is my specialty, and I am a nurse educator full-time and doctorally prepared. And today we're going to talk about gatekeepers in nursing school. And you may be like, what is a gatekeeper and what does that mean? Gatekeepers are people who basically keep information, okay? They keep information that they have and do not want to share with other people. So we're going to go ahead and dive and dissect this topic pretty good, okay? And I have to talk about not only the nursing students as being gatekeepers, but also the faculty instructors as being gatekeepers as well. So let's go ahead and start first with the nursing students. So when it comes to being a gatekeeper, basically what I mean is for whatever reason, students will be privy to information. They would have gained access to information, but they want to keep it all to themselves. Please understand that nursing school should be a environment in which all students work together, with the exception of test time, mind you. All students should be working together to make sure that we all get together and have the common good of moving forward together. So if I have information about something that could help my fellow students, I should be able and willful to hand that information over. But in nursing school, you're going to find a lot of gatekeeping, cliques, if you will. So gatekeeping, what does that look like? It's simple. It may be that you and let me say this too. Gatekeeping often occurs when you have a majority who looks like my hat and the minority who looks like my skin tone. You will see people who they will gatekeep and keep information from the minorities, and then minorities don't get to have privy to the information, but yet you knew about something. So an example of that could be something as simple as the faculty member may have given information to those said Caucasian students about what's going to be on the test. Okay, maybe they gave them a study guide or just gave them some clues, but yet they didn't give that to the rest of the class. The rest of the class then fails. Okay, I have seen this happen time and time again. So if anybody want to come in here like, well, my school did, okay, I know every school doesn't do that, but I'm going to tell you, it goes on more than you think. This even happened when I was in nursing school back in 2002. So please understand that this does occur. It occurs quite often, especially to the BIPOC community, where they do not get the information that their said counterparts do receive. So that's an example of what I'm talking about, where maybe you have, there was, again, points to be giving on something, some type of extra credit or some type of extra bonus points or something, and these students know about it. Or they know, maybe they know about a great study tool that maybe the instructors did not give them, but they found a great study tool that they knew that would help them, or a different way to study, a different reference or resource to help them, but yet they purposely did not tell everybody. And you may say, well, they don't have a responsibility to tell everybody. No, they don't. You're right. They don't have a responsibility to, but we're all in this together, right? Doesn't that build teamwork? Doesn't that build a sense of community? And what do you think we're supposed to have on the floor when we work with other nurses on the floor? That same component of teamwork and community to help our patients. That's what this is really about. It's not really even about us. It's about our patients. So with that being said, we need to do better when it comes to those types of things. Now, let me go to the faculty side of this, right? There are times where faculty gatekeep as well, not just from other students, but for faculty. You will find faculty, and I'm going to get more specific here, you will find that faculty will sit there and have their pet students, shall I say. Yes, faculty is guilty too. They'll have their pet students and they will, again, see no wrong in them. They all make the good grades. They all are the teacher's helper or whatever happens to be. And they have privy to information, again, that the rest of the students, and this doesn't have to be a race issue. It could be more, it could be somewhere where it could be a discriminatory thing because the student is gay, transgender, wears makeup, and is a man. I've seen this happen where they have some implicit and some explicit biases as a result of their own issues, insecurities, and they give privy information to certain people and gatekeep against those who also need that same information but won't give it to them. This also the same culture that lends itself to cheating. Okay, so I said this in a TikTok. We all have no problem gatekeeping anything until it comes to cheating. Then when it comes to cheating, we get certain people get the answers. Okay, or it could be considered to be gatekeeping too if you think about it. So we need to be mindful of that. I want you to be mindful that you may be in a program that practices a lot of gatekeeping. I need you to watch fellow students and watch your instructors. When you always see certain students getting to do things, when you always see that they're making better grades without the better effort, when you start seeing that, something's not right with that situation, that could be gatekeeping that is taking place in your learning environment, in your institution. Be mindful of that. Also, I want to say something about faculty members as well. Faculty members have been known to sell, give access to quizzes, to tests, to things like that. And you're wondering why some students who don't look like they have studied anything, or in the previous classes they have failed everything, but now they're passing. Guess what? They're not going to pass the NCLEX, so don't you worry about them. Karma's going to come back for them. It will. So, but if you have proof of these things that's going on, I do recommend you report that, because that is a lack of integrity. And if you have to study and do things the right way, why does everybody else get to not do so? So I want you to be mindful of that mindset, that things like that, this does happen in the faculty, in the nursing school era. And the gatekeeping component, in my opinion, stems even back in terms of not pre-nursing, but it stems back into the nature of what nursing actually is when it comes to your girl Florence Nightingale, and the stigma that comes with her when she wanted people to have certain access to nursing school and others not. The whole premise is to keep people down. The reason why we gatekeep is because we have some insecurities within ourselves to keep people down. We don't want people to know what we know because we want to stay ahead of other people. Why do we want to do that? That's a reflection of ourselves. If I have information, right, and it has helped me, I'm going to say, hey, this helped me, so let me go ahead and pass this information to you to see if it can help you as well. If I don't do that, what am I insecure about? I have no insecurities when it comes to growth. I always feel if one rise, we all rise. I want us all to be better nurses. I want all my students to have access to information, not just one student. And for me, I'm not going to cheat or lie for my student anyway. But you will have faculty who will do that, who will lie and cheat and give you passing grades and do all these things. And those are the kind of faculty and those are the kind of students we do not want in the nursing profession, period. So that concludes this video for today on gatekeeping for both the instructor and the nursing student. I want you to look out for those things in your own nursing program and comment them below. Have you felt like you've been a victim of gatekeeping, where somebody has been privy to information and you have not? Let's talk in the comments. Let's chat. And until the next time, you all take care. Bye-bye.